However, blood, be it TSH, T3, T4, free T3, free T4, according to Sir Dr. Richard Bayliss, head of the Endocrinology Society in Europe, stated that none of the blood tests are valid. Simple. And he went on to say that the only things that were valid were reflexes and symptoms.
Hi, and welcome to The Balancing Point. I'm Dr. John Nieters, and I'm here to make traditional Chinese medicine, functional medicine, and integrative health simple, practical, and fun, so you can restore balance, boost vitality, and enjoy a healthier life every single day. Hi there, this is Dr. John, back with another episode of The Balancing Point, and I've got a very fascinating show today. Now, I know I say that fairly often, but it's true. My guests, I just can't believe I'm so fortunate that they come on. And today our guest is Dr. Daryl Turner. Now, I mean, that he's willing to come on my show, I'm a small fry in this world, and he's been on the Dr. Phil show, the Doctor's show, the Today show, Discovery Channel, and you name it. And he's been commissioned to write 5 books, 2 of which are in the final edit. And of course, I've gotten 2 out, and those were labors of love. It was like delivering a child each time. And so it's very impressive because of all the other things Dr. Turner does. He's a hormone specialist, focuses on thyroid, iodine, adrenal, and then DNA and RNA. And that's something I'm really excited to find out about it. And he invented, patented, and developed a clinically trialed hormone testing device, plus the supporting advanced innovative medications for the treatment of hormone balances. Now, I've got to tell you, Dr. Turner has got a device that he uses that I didn't even know existed, but apparently it's been already used on 3 million patients, which just shows you how far behind I am on this particular area. It's a fascinating thing, and I've got tons of questions to ask. And one of the things that I was really excited about is that one of the things that I saw was your discovery about how to put Hashimoto's into remission. And boy, what a blessing that would be. I mean, we've gotten good results, but rarely get into complete remission. So I'm very excited that you're on today, Dr. Turner. So tell us.
Thank you, Dr.
Yeah.
John.
Oh, you're so welcome. I'm just really excited to have you here. And there's a book, maybe Datis Karatsian wrote a few years ago, and I love the cover of it. It's a woman literally screaming and pulling my hair out, and it's titled, "Why Do I Still Have So Many Thyroid Symptoms When All My Tests Are Perfect?" And I think you're the perfect guy to answer that question. So talk
That's
to
a
us.
very, very good question, and it comes up all the time. Up until the mid-1970s, the doctors of old used to use a reflex test to determine the condition of the thyroid, whether it was hyper or hypo. And you're a gyno, John, and you may have done in earlier part of your career a heel kick test where you judge the speed of the reflex of a newborn baby.
Mhm.
When I was born, of course, they didn't use a heel prick but a heel kick test to determine if my thyroid was normal. In the 1940s and 1950s, my doctor used to sit me on his table, and he used to hit just underneath my kneecap and judge the speed of my reflexes and ask me some questions. It's called the Waltman effect. Waltmans. Waltman's effect has been in use for about 200 years. It's in the 90% accurate. It's very, very accurate. And doctors of old could actually judge those reflex speeds. Today, we've lost that skill because in the mid-1970s, they decided to use blood. However, blood, be it TSH, T3, T4, free T3, T4, according to Sir Dr. Richard Bayliss, head of the Endocrinology Society in Europe, stated that None of the blood tests are valid. Simple. And he went on to say that the only things that were valid were reflexes and symptoms. So unless you're getting reflex tests and symptoms, there's a high probability that is not being picked up. Why? Because bloods are only 18% accurate, where the reflexes are 98.5% accurate. So it's a fairly high range, or you've got to be severely thyroid for it to be picked up in the bloods.
Yeah. Now, it was before my time, but I've been told and read that thyroid treatment was actually more accurate before they started using thyroid stimulating hormone as a test, because they would go by symptoms, right? And it's like when your
Symptoms and
symptoms went
reflex.
away, your
Yeah.
signs went away, and your reflexes were normal, okay, now we're good. But the
Yeah.
over reliance, I'm not even saying it's a good or a bad test. I'm just saying the over reliance on TSH. And most of the patients that I see that come in, unless they have a very, very specific known thyroid problem, all they get is a TSH and maybe a T4. But certainly there's so much beyond that.
Yes. Yes. The bloods are accurate, Dr. John, for TPOAB, TGAB, that's Hashimoto's, Graves, and reverse T3,
Mm-hmm.
but not for determining hyper or hyperthyroidism.
Okay, good. And so I can't wait. Tell me a little bit about your testing.
Sure. I um, was I was sort of perplexed as patient after patient would come in. We'd do the blood test, but they told us they had all these symptoms. And we'd say to them, you are subclinical hypothyroid. In other words, there's an easy place with words we could park a patient into and send them home without treatment. I decided to look elsewhere and see what was used in the past. And because in medical school, Dr. John, as you know, they teach us that reflexes, they speed up and slow down with thyroid function. And then they say, but blah, blah, blah. And they cover for about 20 seconds and that's it.
Right.
So I decided to invent a machine with modern technology that tested the speed of the reflexes, tested the neurotransmitter speed, because thyroid affects the brain in a major way. And of course, thyroid controls your weight. So I tested the resting metabolic rate. And I do that in a 4-minute test from start to finish with a device with the Thyroflex machine. And the patient sits down. I did start with the Achilles. That is where all the original research was done. And then I moved it, because it was easier, to the brachial radialis. That is on the arm.
Mm-hmm.
I started to test the arm, and we got a device that sort of worked. And I went ahead and did clinical trials on 2,200 people over 3 years. By the way, we are FDA, CE, TGA, and FSAI approved on it.
Okay. Wow.
Yeah.
Do you find that I'm assuming that reflex speed tested at each of those different sites would be consistent? It'd be consistently slow or consistently fast, yeah?
Doesn't matter which, the stapedial,
Uh-huh.
your heart, because your heart is the biggest reflex muscle in your body. The Achilles, any reflex point is controlled by your thyroid. So you can test any of those points, and we correlated the Achilles reflex with the brachial reflex 99.9%.
Wow, that's amazing, and certainly a lot easier to get to. Yeah, that's
Yes,
fabulous.
yes, yeah. Well, sometimes it was difficult when you got a 300-pound woman in the middle of summer in Phoenix on a chair
Yeah,
backwards. She had to
right.
take the shoes and socks on. It wasn't a very pleasant experience.
Well, I used to work a lot of evenings, and I'd see a lot of people after work. Now I work early in the day, so it's not as bad, but I would get a lot of people after work, and I'd say, kind of, okay, please take your shoes and socks off, right? Kind of
Yes,
holding my breath a little bit.
exactly. That's why I moved it to the brachioradialis. I mean, to the arm.
Right.
Yeah.
Excellent. And so you were in Arizona for a while then?
I live in Arizona. I live in
Oh, you do?
Scottsdale, Arizona. I'm sensible, Dr. John. I get out in the middle of summer.
Yes. Excellent. Catherine Black, who's my associate that I've written a couple books on, and she's really the brains of the outfit. I'm just the pretty face sitting here. And
Yeah.
she's from Arizona. And, you know, she put up with it as a kid, but she said she can't even go back there anymore. It's just way too hot for her.
Yeah. Yeah.
Yeah.
My kids and my grandkids live in Arizona and they
Uh-huh.
stay there through summer because they're tight. They have to earn money. And,
Uh-huh.
so they're stuck. But my wife and I, we escaped over to Australia
Great move.
when it's really hot.
Yeah, and it sounds like you might have some experience with Australia. Your
Somewhat.
accent? Your accent?
No, I'm not Australian. Uh, but g'day, mate. How'd you be? You pick up with an Australian
Nicely
accent,
done.
eh? Yeah.
Nicely done. And so, again, you were mentioning that the blood tests are notoriously inaccurate.
Yes.
How would somebody find one of your centers to get tested at?
Well, we have about 800 centers around the world. We have a website. You go to our website, you ask us where our centers are, and they're fairly easy to find.
Mhm.
And that's at nitecmedical.com, and we will tell you where our centers are. We had a lot more centers, but COVID wiped out a lot of our centers
Yeah.
because a lot of the offices closed down and never
Well, it would certainly be
reopened.
hard to do telehealth with that type of testing.
That's correct.
Yeah.
Yes. Yes. Yeah.
Yeah.
In fact, we had one group had 28 clinics, and all they did was their whole clinic was based around my core hormones and my testing, and it wiped them out. They couldn't afford the overheads during the
Right.
1.5 years of COVID shutdown.
Well, I've gotta tell you, I have this package of information that I have been looking at, longingly, I must add, waiting to meet with you, and your check-in sheet is amazing. The way that you've
Thank you.
correlated different things, and so just in one quick check-in sheet, you've got so much information here that can really guide not just thyroid, but a whole core of neurotransmitters. So very just
Yes.
the intake sheet is impressive.
Yes. I developed that because you cannot balance the thyroid by itself. The thyroid is the grand central railway station of all of your hormones and your well-being. So what I cover is the patient knows best, Dr. John.
Mhm.
If they come and see you, say, I've got a pain here, then this is where to look, but it may be connected with something down here, right?
Right.
Pain of the shoulder could be the heart. At least they're telling you where to look. And so what I did is I thought through the whole process of what are the primary hormones that affect the functioning of the thyroid. Well, the first one is the adrenals. The adrenals have a major impact on 3 different levels on the thyroid, and adrenal stress or adrenal exhaustion just before Cushing's and Addison's actually causes the body to start to pull, that is, increase the T. And if the T4, which is a conversion problem, starts to increase, you trigger an RT3 marker in the blood. And RT3, I've been called in as expert witness actually in a couple of international cases where the TSH has dropped low, and I've told them do not increase the T4 medication. They've increased it, and of course, it's caused the patient's demise.
Mm.
So RT3 is something that that our questionnaire triggers you to test for. And the questionnaire also triggers within there when to test for TPOAB and TGAB. So it's a fairly comprehensive system. We're balancing the sleep, the CoQ10, and more importantly, the iodide, along with the stress modulators. But like you said, once you get used to the system, it only takes you as a doctor a few minutes to really summarize the patient up.
Well, it would take me half an hour just to ask these questions and probably an hour to ask them and get the answers to them. And you've got it in this one check sheet. I just love it.
Yes,
And
yes.
we've been talking about and I mentioned to you that my doctorate is in gynecological endocrinology. So at one time, I did a massive amount of fertility work. And what I found is in the patients coming to me, where they had so called unexplained fertility, the problem was almost always stress related. Can you talk about reverse T3 in regards to that?
Yes, yes. I work a lot in India. In fact, I work in 28 countries around the world. And I find that living in a stressful society, like just driving from point A to point B in India, causes it causes your cortisol to get depleted because you're constantly struggling to get from point A to point B. So by the time the average Indian person gets to work, they are already stressed out. In other
Mm,
words, stress depletes your cortisol. The cortisol, as I just said a few minutes ago, acts on the between the hypothalamus and the pituitary, the thyroid, on the thyroid, and the adrenal cortex and the adrenal medulla is affected, and it triggers the body to go into a self-preservation mode, and it starts to go into a system where it stops converting the T4 into a usable form called free T3, and
mhm,
it goes into reverse. So it's instead of FT3, it's 3TF. It does it back to front, and the body simply cannot use it. So the actual patient is exhausted and tired, and they don't know why. And of course, thyroid affects, in your case, Dr. John, the estrogen and the progesterone. So on that questionnaire that you just told me about, that on my little one there, right down towards the bottom of the hypo, it tells you about the estrogen and progesterone. Is your menstrual cycle every 28 days? If it's 29 days or 27 days or anything else in between, that is a thyroid problem.
mm.
Or if you get clotting or your period lasts for, besides a little bit of spotting before and after, 3 days. Um, and of course, this is exactly what you need to know in your practice. So the thyroid plays a major role in that, and of course the adrenals compound that if they're not balanced. In India, there are two things that are really prevalent, way more than in the USA: adrenal exhaustion, because they're also breathing in the polluted air every day on their way to work, and the incidence of Hashimoto's.
Mm.
In the USA, it's 18%. In India, is 60%. And I do know
Wow,
why. I've worked out why.
that's amazing. I see a fair number of patients that have come over from India. Uh, a couple to see, a few to see me, but a lot that have moved here. And I did notice a much higher level of Hashimoto's, but hadn't figured out the entire piece of the puzzle.
I have.
That's fabulous.
Yeah.
Well, yeah, we do a fair amount of work looking at dementia prevention types of things. And more, we see that those 2.5 particles, those little guys, are just destroying people. And here in the Bay Area, we had some big fires. So I'm expecting a little bit of a surge in dementia problems because of that.
Yes.
Yeah.
Yes. Yeah, in fact, dementia, um, for instance, 50% of all Alzheimer's, uh, and a similar percentage of the Parkinson's-like shaking disorders are actually caused by low thyroid.
Wow.
There's a very, very, very excellent study out of Sweden that actually, of course, there's another 50% that we cannot, that we've got to get down to the bottom of it all. But we can say to a patient, once we test them, once we get them on the correct amount of medication, and that's what my machine does. There's no guessing. That we say to them, we point them, says, "Would you like us to reduce your chance of getting Alzheimer's and Parkinson's by 50%?" And
Yeah.
everyone says, "Yes, I don't want to get it." I say, "Okay, you're going to
Yeah.
be on the thyroid, what we call the trifecta, thyroid, iodine, and the D3 for the rest of your life. Are you okay with that?"
That's
Uh,
great.
yeah, because as you said, the dementia, uh, the uh, the uh, the little particles, they all play a role in the deterioration of the brain, but the major role is the slowing down of the brain with hypothyroidism, which we measure for through the measuring of the neurotransmitters.
That's fabulous. I did a continuing education class and then also a podcast on bedside diagnosis. And I read from a book by a United Kingdom cardiologist where he just went on this rant. And my wife gave me the book because he went on the same rant that I go on often. It's like, look at your patients, listen to your patients, right? They'll tell you
Absolutely
what's
true.
wrong, right? And, I think there's just this tremendous over reliance on certain technologies like blood tests and not really up to the date things like what you're doing. Now, in Chinese medicine, most of our diagnosis is pulse taking, looking at the
Yes.
tongue, looking at colors, etc. And they did some brilliant stuff. I mean, it's like patients come in with POTS, postural orthostatic tachycardia syndrome, which we see a lot after COVID. Well, you can tell most of those patients just by touching their pulse because they're all slightly not. I mean, I don't. A surgeon would think I'm nuts, but they're slightly hypothyroid. I mean, hypovolemic, and the blood doesn't actually fill the vessels when I'm pressing on it. And sure enough, we take them in and do a Ragland's, like a tilt table test,
Yes.
and they fail every time. And so then we're looking at low sodium levels, not, pulling water into the bloodstream as kind of a starting point. Of course, it's infinitely more complex than that, but that's in the first 5 minutes of
The sodium
diagnostic.
symporter, yes.
Yeah. And we find here in the US, at least, people have become so salt phobic that we catch a lot more low sodium patients than we catch high sodium patients, a much, much higher rate. So,
Yes. That
yeah.
that is true. People people become fat phobic, and you need a
Right.
certain amount of fat for the
Right.
body to function properly.
Yeah.
And when they're going on these special diets, and of course they're trying to avoid salt at all costs at all meals. When you need a certain amount, because the thing in your body called a sodium symporter, the pressure inside and outside of the cells, there has to be in balance, and that's what the sodium chloride does.
Hmm.
Yeah.
Fascinating. So you create this T symptom survey. Now it's way more than thyroid. I mean, thyroid I can see is really at the key, but you do other hormone treatments also, right?
Yes, yes. We specialize in all the hormones. We do the estrogen, progesterone, testosterone, but we don't. Once again, this is where I can't treat a patient with just using blood. I have to have either a urine or
Hmm.
a saliva. Yes, because Dr. John, you already know this. Blood may tell me that for instance, the estrogen in a female is very low when it could be very high. And the intercellular use is showing up in the saliva and urine, not in the blood. So that's why we insist on saliva
Yeah.
as the best medium to test. Once we know that, we actually manufacture, because I manufacture all the hormones myself.
Hmm.
I have my own pharmaceutical companies. I have three locations I manufacture in, and I do all the natural bioidentical hormones, and so I do them in creams, and I do them in I just introducing a progesterone capsule, but I do the estrogen, progesterone, testosterone, oxytocin, etc., in creams and nasal sprays.
Oh, awesome. So everybody watching, I want you to get this. So I'm 75. I'm not going to tell you how old Dr. Turner is, but he's older than I am. And look at this guy. He really lives what he speaks, right? So
Yes,
you're doing something right.
I'm taking my own hormones.
Yeah, that's
But
great.
Dr. John, it's quite amazing. My thyroid is normal. I don't have to
Yeah,
treat my own thyroid. But my wife had Hashimoto's. She no longer has it at all because of my discoveries.
got you. So I have a question for you. I don't know if it's a little off topic. It's for me. So I was born in Yakima, Washington, which is kind of
I know where that
eastern.
is. I've been
Yeah.
there.
And so it's come out over the last 20 years. They finally admitted that the Hanford refinery was releasing radioactive iodine while I was a baby. And the mothers were pushing milk like crazy. So you got the cows eating the grass with radioactive iodine. And I have had a wonky thyroid ever since the first time I was tested. Do you think that could have affected it?
Radioactive iodine kills the thyroid.
Yeah.
I came out of the same situation. I was actually born, you just asked me, am I Australian? No. I was born in New Zealand. The French kept on, there's a little island right next door to New Zealand called Mururo
Uh-huh.
Atoll, and they kept on doing atmospheric tests with nuclear bombs. New Zealand was constantly bathed on a consistent basis with radioactive iodine. It went into our grass, it went into the milk, went into our total food source. I came out okay because I left early enough, but they kept on radiating New Zealand with with radioactivity, and they wouldn't stop. Um, First of all, your thyroid is dependent on iodine. In other words, if you're exposed to high doses of radioactivity, iodine is what we give the patient straight away. When the
Mhm.
Chernobyl went
Right.
up and the clouds started to drift across, I got a ton of phone calls, and because we make the high dose iodine, the 50
Huh.
milligrams, and I got everyone immediately onto 50 milligrams of iodine just in case. So it does it can affect the thyroid. But I want to also tell you that virtually all cases of thyroid disorders are hereditary.
Hmm.
That either your mother or father have it. It's a genetic gene. Once it's in your gene makeup, it goes through the whole family. In
Hmm.
other words, if one of your patients has it, then you know that their siblings have it, their children have it, and the parents had it. And quite often you can ask the history, blah, blah, blah. And, oh, yeah, my mother had this. My mother had Alzheimer's and she had this, and all the whole story comes out, the whole connection. But to answer your question directly, for New Zealand and for Yakima, which is the apple growing area, if I
That's
can
it.
remember.
Yep.
Yeah, yeah. When I went through there, radioactive iodine, yes, it will have a major impact on your thyroid.
Okay.
And if you're born with a thyroid disorder and it gets radiated, then it's going to make things worse.
Okay. Thank you. That one's very personal. Thank you. Now, yeah, as you know, the looking at the periodic table, right? Iodine's a relatively large molecule, but then we've
Yes.
got bromine, chlorine, and fluorine, which are all much smaller and can bind and block the iodine uptake, right?
That's exactly right. The iodine's got to get into the mitochondria and into the cell to do its work. So there's a little hole it's got to go through. If fluoride or bromide or chloride, which we find in our breads and our water, etc., it binds and it cannot get through the hole.
Hmm.
Iodine goes through, it cannot get through the hole to do its work. Iodine is required in every cell of the body. So no one is allergic to iodine because it's required in every cell, but to get it in there can be a problem if you've got high exposures to fluoride, which is in the water, or even swimming, bromide, which you find in your white flour and your breads, and quite often they bromate the water as well, and of course chloride, which is also a cleaner, industrial cleaner, and of course sodium chloride is salt.
Mhm.
Stop the uptake of the chloride and the iodide because it binds.
Well, that brings me another question. I've seen patients who've told me that they had an iodine allergy. And what I suspected was that it was actually the effect of maybe driving those other three chemicals out of the receptors. Does that make sense?
It totally makes sense. In fact, because these cells are cleaning themselves out once we get iodine into the cells. I mean, look, when I was young and I got a cut here, my mother would put this orange stuff on or this yellow stuff that used to sting. It killed all the pathogens. Now
Mhm.
we're giving it to you orally, and it's killing the pathogens. So you get a thing called a kill off effect within the cells. Sometimes you don't feel very well. In fact, I personally, when I first started myself on iodine many, many years ago, I actually got a little bit of the kill off, and I had to cut my iodine in half for about a month, and then I went up to the dose. The dosage, by the way, was established by a Dr. Lugol's in
Yeah.
1847, and his body of work was continued on by Abrams, Fleischer et al., and put into practice by David Brownstein. And David and I are on the same page as giving our patients the right amount of iodine. I do have an iodine testing machine, by the way, and using iodine to also stop any breast lumps turning cancerous, reversing them, anything to do with the uterus, thinning the uterine lining, and the cysts within the uterus, like a Bartholomew cyst, or cysts on the ovaries, and of
Yeah.
course, with our male patients, prostate enlargement. So iodine has a lot more uses than just making the thyroid work, but initially you can get a kill off, which means you back them back and then you titrate them back up again.
And so we use Lugol's, probably not as good as what you've put together, but do you think it's still a decent formula?
Yes, it is. Yes.
Okay.
We follow the Lugol's. I don't know how he did it in 1847. Not only did he find that 12.5 was the correct dosage, but he also found out that that the portion between iodine and iodide has to be correct for the
Hmm.
body to uptake it. Now, the problem with the Lugol's drops is that a vertical drop and a horizontal drop or anything in between is very difficult to judge for the average consumer. That's why we give them a capsule.
Gotcha. So if we didn't have access to yours, would you maybe use iodoral instead of the Lugol's for that?
Yes,
Okay,
absolutely.
okay.
Iodoral, of course, was developed by Abrams, Fleischer et al.
Wow,
Yeah. I've
fascinating.
enhanced it a bit more since then.
Okay. Yeah, sometimes it's just well, for me, I'm looking at 2,500 years of history, and at least once a month, I'll, like, have to pull my car over or stop and listen to something again as Western medicine is discovering something that the Chinese were treating 2,500 years ago. By the way,
Absolutely.
there's a famous, Chinese physician named Sun Simo in 618 wrote a prescription for deer thyroid and kelp that was burned down. So basically, you were getting iodine. So he was doing that in 600 AD. So a
Yes.
little bit ahead of his time.
Yes. Yeah.
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 It just
Because we all
it's
need other.
amazing how people come up with these things.
In fact, the lowest incidence of breast, uterine, ovarian, and prostate cancer in the world is in Japan, where they have an
Mhm.
average intake of 13.8 milligrams a day.
Yeah.
And as you know, the iodoral or the biodine that we make, um, 12.8, which was discovered, is the correct maintenance dosage. Now we use a lot higher under certain circumstances as well to
Now do you
reverse any lumps, bumps, or deaths in
okay.
any of the hormone-driven areas.
Yeah. And that's because those tissues need a higher amount of iodine, correct?
Yes, yeah. In fact, we have an 87% chance of reversing any of those lumps or bumps, and of
Okay.
course, those lumps or bumps are the precursor to the various cancers,
Right.
hormone-driven cancers.
Do you ever have women do topical iodine, say on a breast lump, or do you just do internal?
We do internal. The topical iodine, if you read the research, is not valid
Okay.
because it evaporates.
That makes sense. Yeah.
You can apply. Some doctors I know do a poultice where it's covered. They use iodine on the breast tissue where they cover it so it can't evaporate, and it does migrate through the skin, but just applying it topically does not work.
Interesting. I studied with one short time with one cancer doctor in China, and most of the people I studied with were MDs and Chinese medical doctors. This one
Yes,
guy is just an old timer, old timer. He had this little office in this murky old part of town, and people came from all over China to come to see him for a variety of cancers. And what he would do, he used toad skin, which is poisonous, basically, but it
yes,
was used as a carrier and high dose iodine, and he'd put poultices on. And like I said, people were just, they would show me, they were so excited, talk about their breast cancer, even stomach cancer. And he got great results with it. So,
yes,
yeah,
yeah.
very cool.
I I have seen some good results with poultices and iodine,
Cool.
but putting on the skin doesn't work.
Okay. Yeah, that makes perfect sense. So, if someone do you put much it doesn't sound like you put much stock in standard blood testing for most thyroid conditions. I understood the autoimmune pieces of it and the reverse T3 you like. Yeah.
If the TSH, I'll just clarify that. If the TSH is very suppressed or very high, we send them out for a thyroid scan. I want to know if there's any woody nodules or hot
Mhm.
nodules. Um, so other than that, we put no reliance whatsoever on the TSH, T3, T4, free T3, free T4. They're simply not valid. Because as
Okay.
I said, not only that, I have doctors on my staff that do my lectures, my staff doctors around the world. I have quite a few doctors on my staff. And Dr. Rashmitha came up with some research that she just presented at a major conference in India that that not only is 18% of it found in the, but only 0.5% of it is active.
Wow. Amazing.
I don't use that statistic because that's what she discovered
Gotcha. That's
in her
amazing.
lecture. And
So
uh, it's like testing for, in your field, the bound and unbound estrogen, for
right.
instance.
Yeah.
Makes a major difference on what the body can and cannot use.
Right. So we will do saliva testing. We do more and more urine, just mostly because it's easier. People go crazy trying to spit in those little tubes. But of course, at that with the urine, we're testing really metabolites, right? And so,
That's correct.
yeah.
Yes. Yes.
And do you feel that's accurate?
Very accurate. You're using the Dutch test then,
Yeah,
and the founder of the Dutch, him and his wife are both very good friends of mine,
that's great.
and I believe in the test. And in fact, in India, they didn't do any saliva tests. I've just introduced saliva testing, and I've also introduced into India reverse T3 as well testing,
Gotcha.
because they are essential. As you just mentioned when we were talking offline, the incidence of reverse T3 is increasing. And you've got to pick it up because it will stop the thyroid medication and the thyroid from functioning.
Hmm. Okay. Now, if someone were taking, let's say, levothyroxine, sodium, would it change your dosing on the iodine?
No,
No. Okay.
standardized 12.5 milligrams is
Excellent.
maintenance dose for an adult. We do the smaller doses for children if the iodine and deficient, or the super high doses if they got lumps or bumps caused in their breast tissue, or uh, uh, prostate enlargement for yourself, or
Gotcha.
any of those other things. Yeah, we have a special protocol for that.
And if you determine that there's low T4, low T3 by your testing, what kind of products would you use for that? Would they
In
be
our clinical trials on 2,200 people, we use over the counter, we use the T4 alone, we use the T3 alone, we use a combination of T3, T4 synthetic, and we use natural bioidentical.
okay?
What we've found is that they all work
Hmm,
in various ways. And for instance, the T4 synthetic, it works, right? But you're going to put your patient onto a seesaw because the T4 loses its efficiency, and it drops down, and you've got to raise it, and then drops down and raise it. So it's to continue like a seesaw for them. Um, with the T3, very good. We use it all the time for the reversal of RT3. It's very simple, very straightforward. That is synthetic. Um, but we found that the medications with T1, T2, T3, T4, and T6, that's a natural bioidentical, performs a lot better. Not only does it perform a lot better, but the patients, once we get them to the right dose, titrated to the right dose, they're on the same dose for the rest of their life,
hmm,
and it
okay.
just keeps on performing. Yeah.
Now, you just, I'm sure, raised a question for 99.9% of our listeners. Can you say something about T7?
T7 is a combination of T3, T4.
Gotcha. That makes
Yeah.
that's
Yeah.
super, super. And if someone wants to get tested, they just go to one of your centers. Do they sign up, or do they need a referral from anybody?
Uh, well, besides coming to your center, uh, they, we have centers up in where you live. We
Mhm.
have centers. We have 800 centers around the world, which you just email us and we'll tell you where your closest center is.
Excellent. Super, super. Well, I'm about ready to let you get to see your patient, and anything you wanna I mean, I could talk with you for days, right? You know, you're just fascinating. You're just a fount of knowledge, and, I
Well,
mean,
we
I
haven't
consider
talked about
myself
touched
Uh-huh,
on D3 yet.
okay, let's do it.
So, the trifecta for treating thyroid is if the patient needs thyroid, which according to Broder Barnes
Uh-huh.
in his book, and according to Terry Hertog from Belgium, who I co-lecture with, um, they speculated in their books that 80% of the population has thyroid issues. Um, and um, and we have found that it grew from 30% in 1900 to about 80% because of modern intervention. Once it's in the genetic pool, it's in the genetic pool. So high probability that a lot more people are suffering from thyroid, but it's not detected because of bloods.
Mhm.
We like to go for quality of life. How do you get the quality of life back if you're exhausted and tired and you've got constipation and your menstrual cycles aren't right? In fact, I say to a lot of my clients, do you have a teenage daughter who's about to become a teenager? They said, yes. I said, you can stop her from ruling the house by simply balancing out her core hormones, her thyroid. um, and so she doesn't rule the house.
Yeah.
But we go for something called quality of life. You cannot get quality of life if your thyroid is not in balance. And we pride ourselves in quality of life. Just before you asked about Hashimoto's, yes, in my clinical trials on 2,200 people, I did discover, and that's what I'm on the worldwide lecture circuit for, how to reverse Hashimoto's autoimmune, which, as you said, I said before, affects 18% of everyone in the USA and 60% in in India, which we didn't get to the bottom of that, is because of lack of iodine. It's because of vegetarian diet. No iodine.
No iodine. Yeah.
And when you look at the mitochondria and the cells within the mitochondria, it lack of iodine sets up if you already have low thyroid it to change into an autoimmune response. Um, and so that's all about quality of life. If you have Hashimoto's, you feel terrible. If you
Yeah.
have Graves, you feel terrible. You know, if you have reverse T3, well, that's a precursor to Cushing's and Addison's. You got to stop it. Um, whether using our system, we give back the patients their quality of life, and that's why I'm still working and still spreading the word. um, we can get back the quality of life that you've been missing out on for most of your life. This is a hereditary problem, nothing you've done wrong, but it has to be identified and treated, and only hormones can replace hormones.
So I've heard that, and I don't know if this is accurate, that, before 1900, let's say, that people with very, very low thyroid hormone often died fairly young because they couldn't fight infection. Does that seem accurate?
Absolutely true.
Okay.
Yes.
And so now
Yes.
we've artificially kept people that would have died alive, which is awesome, but now we've created this huge gene pool of people with thyroid problems.
That's true. Yes, I'm a DNA RNA specialist. For instance, if you have Hashimoto's and Graves, it automatically triggers. We know that it's a DNA problem. We test your DNA and we do an RNA intervention. You don't have to learn about it, Dr. John. I do it with you, with you, with yourself and your patient.
That's
It's
awesome.
a service that we offer, and that's where we've got people up walking out of wheelchairs even, who are so debilitated by their autoimmune conditions, and we have incredible results, including my own wife,
Huh.
who had Hashimoto's. It's a thing of the past, and we're now approaching patient number 500,000 who we've reversed out of autoimmune Hashimoto's and Graves. And by the way, with our Graves patients, we haven't had to do a partial ablation
Mm.
out of all those
Wow,
patients.
that's amazing.
Yeah,
Well, I'm just absolutely stunned by your information, and I'm really enjoying your infectious enthusiasm and that you're willing to and again, that you're still so active and doing so many things. so positively should be a real goal for patients, right? That they can still be as active as you are and as bright as you are at this age.
I take my own medicine. I take I take a handful of
Uh-huh.
capsules every day to keep myself balanced and
I love
online,
I
and
love
it
it.
works, obviously.
Well, it obviously works. I
Yeah.
mean, you've got your fingers in so many pies, out there in the world and still lecturing and teaching and also seeing patients. So again, you're quite a role model. So
Yes.
thank you for
I
being
don't
on.
see, Dr. John, unlike you, I don't see patients on a day-to-day basis.
Uh-huh.
I'm seeing this. I see some patients either over Zoom or in person if they're local with other doctors.
Got you. Okay.
Nowadays, is part of a teaching experience.
I love that. I love that. Well, like I said, I could sit here and ask you questions for another year, but I will let you get back to your
Thank
seeing your
you.
patient. And I can't thank you enough for being on here and sharing your wisdom and also your wonderful spirit with us.
Dr. John, there is a solution out there. It's called quality of life, and we're able to get it back for you if you allow us to do the right things. Thank you for
I
being
love
on
it.
the show.
Thank you for joining me on The Balancing Point. If you enjoyed today's episode, please follow the show, share it with a friend, and leave a review. Feeling out of balance? Most approaches just manage symptoms. Here, we get to the root. So, real healing, real clarity, and balance can begin. Visit alamedaacupuncture.com. That's alamedaacupuncture.com to learn more, explore our supplements, or book a call. We'd love to hear from you.